Hey, Dr. Daniel here. And in this video, I want to share a few high-level concepts for anyone struggling with high blood sugar, pre-diabetes, type 2 diabetes, or insulin resistance. Now, if you've paid attention to any of the information that I share related to blood sugar disorders, you'll know that keeping your blood sugar regulation on point is very crucial for optimizing health. Regardless of your health condition, whether it's autoimmunity, hormone imbalance, weight loss resistance, digestive dysfunctions, chronic inflammatory conditions, even if it's just optimizing your health and trying to work on improving recovery, it really doesn't matter. All of them are going to be negatively influenced by poor blood sugar regulation. So very important to make sure that you're getting a hold of this. Now, most people dealing with blood sugar dysfunctions are stuck in this significant vicious cycle of metabolic errors and metabolic syndrome. Those people need to have a very strict diet to make major changes at the cellular level, and it's important to proceed in an appropriate fashion. If you have kidney disease or nephropathy, this information isn't going to apply to you. But for everyone else, listen up. So the first thing that you want to do when you're dealing with hyperglycemia, high blood sugar, hyperinsulinemia, high insulin, pre-diabetes, type 2 diabetes, is to start with increasing fibers. Primarily, you're going to do this through your diet, and you're going to want to do a combination of both soluble and insoluble fibers, and make sure that you're not going too fast, because if you're somebody that isn't used to consuming fibers, adding a whole bunch is going to result in some symptoms that are going to be expected, right? So that's totally normal. So again, start slow, build up. You absolutely want to work on increasing your fibers. Again, primarily through your diet and then also through supplementation. You're also going to want to work on reducing simple sugars. You're going to want to decrease carbohydrate loads, basically anything that grows in the ground. You want to decrease meal size. That is very important. And then, of course, zero late night snacking. Now, the goal during level 1 is to really work on getting rid of any sugar cravings that you have, especially after your meals. Also energy balance after your meals. So basically, you're going to start with level 1. You're going to do all these recommendations. You're going to do this for 2 to 4 weeks. And if you're still having cravings, then there's really 2 possibilities that are occurring. You're still eating too many carbohydrates or simple sugars in your diet, or your meals are too large for your metabolism to really handle it. So just make sure that you're paying attention to that. Sometimes people will also get fatigue after their meals. And again, this is another indicator of having too much food. Basically, you could be eating, quote, healthy food, but if your portions are really big, it's going to result in this massive insulin surge. And so you want to be paying attention to your portion sizes. Now, the next level, and again, you do not want to proceed until your energy is better after your meals or you don't have any sugar cravings. But the next level is going to be level 2. And this is where we would begin incorporating a ketogenic diet. And the key thing with ketogenic diets are that you're going to transition into a high-fat diet. Now, high-fat diets immediately drop insulin levels, sometimes as much as 50%. And that insulin level being high, the hyperinsulinemia, is the thing that's disrupting the brain satiety centers. There's a whole lot of factors that are going to occur because of high levels of insulin. There's some vicious cycles there that work on increasing inflammation. It works on activating lipocytes, which of course contribute to obesity. There's a lot of factors there, right? So this is very, very important. And when we consume fat, it pretty much has no impact on blood sugar. High insulin also impacts mitochondria, which are the structures that generate energy. It impacts glycation, which can cause damage to our cells. And it also impacts insulin receptors. So it damages insulin receptors. Both of those are not good. So the key concept with a ketogenic diet is that 70% of your calories should be coming from fat, 25% from protein, and then 5% from carbs. Basically, the total net carbs consumed per day are going to be around 20 to 40 grams. And everybody's a little bit different here. So, again, you definitely want to be measuring this. You want to be measuring your grams of carbs that you're consuming. And absolutely, you want to be measuring ketones, not just assuming you're in ketosis because you're, following a particular type of diet. I would also suggest avoiding dairy or any dairy-based cheese. Normally, dairy, I'm going to say, is very healthy, especially if it's coming from a healthy animal. But there are just too many people out there that are inflamed, and casein can be a fuel to that fire. We also know that casein proteins cross-react with the pancreas. And some people, if they have immune dysregulation, which if you do have metabolic issues, you likely do have immune dysregulation, you want to be careful with that. Because again, if you're consuming foods that are cross-reacting with pancreas, pancreas is the organ that plays a major role with orchestrating insulin. That's just not going to be a good combo. Now, I would also advise that you are, again, measuring ketones. I've got a ketone measurement tool. It's from a company called Biosense. That's one that I would highly recommend. There's ketone strips. You can also use a glucometer and then get a ketone measurement, which if you want to check your blood. Either way, you want to make sure that you're truly in ketosis and you're not just, under the assumption just because you're following a diet. Again, just because you've decreased your carb consumption or you're eating a ton of fat, meat, and vegetables doesn't mean you're in ketosis. There's so many people that I talk to where they say, oh, I'm in ketosis, and they're not measuring. They're literally just thinking they're in ketosis because they've decreased their carbs. Don't do that. Make sure that you're actually there. Now, after that, the next step is that you've got to do intermittent fasting. Now, let's talk about the difference with intermittent fasting and prolonged fasting. When someone is intermittent fasting, they're not eating and then eating, not eating and then eating for a different window of time. Prolonged fasting is like someone fasting for multiple days. Sometimes for spiritual or religious reasons, people will fast for an entire month sometimes. So prolonged fasting doesn't have the same effects as intermittent fasting. And one of the main differences is that intermittent fasting keeps you in an anabolic state where you're maintaining muscle, whereas chronic fasting, multiple days, 1 or more weeks, puts you in a catabolic state where you're actually breaking down muscle. So just be careful with that. And this is important for a lot of people that have blood sugar disorders. Jumping in too fast with intermittent fasting is too extreme. So I advise that you start with a ketogenic diet, get fat adapted, and this could take anywhere between 6 to 8 weeks, sometimes even longer. So again, it just depends. You have to be measuring to make sure that your energy levels are going to be right. And then you would incorporate intermittent fasting. Now, honestly, if most people just undergo level 1 or level 2, they're going to respond appropriately. Sometimes, again, level 3. So most people should respond to levels 1, 2, and 3. The final level would involve staying in ketosis, continuing to consume high fiber, and incorporating intermittent fasting. So you're doing all of that. And once you get insulin levels down, once you're in a keto state of ketosis and you're fat adapted, truly fat adapted, and then you start intermittent fasting and you stay in ketosis, you're going to turn on these mitochondrial biogenesis pathways that, again, are just really all a game changer for metabolic issues. So I hope this all makes sense. Again, just trying to provide as much information as I can, especially if you've got something like type 2 diabetes, which is absolutely reversible. And there's no need to be, on medications long-term. You can absolutely change the course of your health history if you just follow these rules.